Hi IR friends, it's Stephanie. Today we're going to review the components of a PICC placement set. PICC stands for peripherally inserted central catheter, and PICC placement is a commonly performed interventional radiology procedure, so it's really important to understand the kit and how to use it. As you may know, PICC lines are typically inserted in the upper arm veins. However, sometimes we also use the set to place lines in the jugular veins at the base of the neck. Okay, let's get started. This is a 21 gauge needle, which is identifiable by the green color designation here. This needle is the first step to actually accessing a blood vessel. You can see, if you look closely, there's a notch here, and as well as that black stripe. That tells you which side the bevel is on. When you access a vessel, you really want to enter in a bevel up fashion. Next is the access wire, which is an 0.18 diameter wire. You have to be pretty careful when you pull the wire out of its casing because it has this really delicate floppy tip. That's actually what we use to access the blood vessel. And the floppy tip allows us to navigate really nicely. The rest of the wire you can see is more stiff and bendy, and it's like that so that you can actually use it to advance devices. Next, we have the introducer sheath. The introducer sheath actually has two components. As you can see here, this is the tapered inner portion. It adds stiffness, and it also allows the wire to be fed. Inside, it has a nice tapered tip, which allows it to slide into a blood vessel. And so when you actually advance the device, it's together. The outer portion is the introducer sheath, or the peel away sheath itself. So after you've gotten access into the blood vessel, now you have actually a hole or a tube that leads from the outside directly into the blood vessel. And this is actually where you can feed the PICC line, and as such. Now these are actual PICC lines, which we have here. They come in different sizes and can have anywhere from 1 to 3 lumens. You see we have a double lumen right here and a single lumen right here. Both of these happen to be 5 French size PICCs, which is a pretty standard size for an adult. You can see each vascular lumen has a clamp that prevents fluid or blood from coming in and out. You can close them like this, after you're done your procedure. Other things to know about is the hub portion right here. You see those little holes. That's where you can stitch it down or secure it down with a stat lock, which we'll see later. And then this is the catheter portion. This is the part that actually goes in the vein. If you look closely, there's little numbers on here, if you can hallucinate that. And that's what allows you to cut each PICC to size after you make a measurement. At this point, we've gone over the important components of the kit, and now we're going to go over the remaining small pieces. This is a small scalpel that you could use for a skin nick. This is, of course, a syringe that you can use to flush your catheter. We've got some caps that you can use to close off the ends if you choose. This device is something that you can use to secure the PICC if you're not going to stitch it down. It's called a stat lock device. There's a cleaning agent you want to use on the skin before you actually apply it. In terms of the device itself, this is what it looks like. You take your PICC line, you fit it right into this little divot right here, and close the wings down on top. And then when you're ready, you peel off the stickers and can apply it to the skin. Oh, before I forget, we also have this handy piece of paper right here. It's actually a ruler. It's got both inches and metric. The metric side is actually more useful. And this comes in handy when you're actually measuring your PICC line. All right. So to summarize, now you know what to reach for when scrubbing into your next PICC case. Hopefully this was useful. We'll see you next time.